Hello everybody, my name is Thida and I'm one of the speech pathologists that work at Speech Pathology. And I thought I would jump on to talk through the different kinds of speech sound errors you may notice in your child's speech. And the reason it's really important to unpack what kind of speech sound error your child is presenting with is because the different types of errors require different types of interventions and strategies to practice. So the key to correcting these in the most effective way is to understand what kind of error you're working with so that you can use the right types of intervention. And it's also important to understand the kinds of errors presenting because some errors that occur are typical as part of a child's speech sound development. So going into them, there are three different types of speech sound errors. The first is a phonological based error. The second is a articulation based error. And the third is a motor speech based error. So going into the phonological based errors, these occur when a child is swapping or dropping a target sound from the word they're producing. So a swap may look like a R sound being turned into a W sound, so saying wed for red, or it might look like a S sound being dropped from an S cluster, like saying cool for school. So some phonological errors do occur as part of speech sound development, and you can see different ones occurring up until the age of about 5 or 6. So if you're not quite sure whether the phonological errors you think your child's presenting with are age appropriate or not, you can jump onto the Speech Pathology Australia website or onto our Speech Pathology website, because we do have content and blogs up there that go through the different types of errors you can see at different ages. And the second type of error is an articulation-based error. So these occur when a child is pronouncing the sound they want to, but the pronunciation is distorted, or the way they're pronouncing it has a bit of an indistinct quality. So that might look like saying a instead of a clear s sound. And articulation-based errors don't typically occur as part of speech sound development. So if you do feel like your child is distorting some of the sounds they're pronouncing, it is important to get advice from a speech pathologist just to make sure they can correct the sound and then get the right intervention to correct that. Because an articulation-based error does occur when a child has developed an incorrect motor plan for how to pronounce a sound. And so the longer it is within a child's speech system and they're pronouncing the sounds with that incorrect motor plan, the harder it is for them to correct, because they're just getting more and more used to it. Similar to if you had to swap writing from your dominant hand to your non-dominant hand. The third type of speech sound error is a motor speech based error. So this one occurs more when it's challenging for the child to sequence different types of speech sounds really quickly together, like we have to do in words. And this can be even more challenging if they're pronouncing sounds that have very different mouth movements. So for example, having to go really quickly from a t sound to a g sound, like in the word tiger. Now this occurs because it's difficult for your child to plan the different motor movements. So what it might look like in your child's speech is that they seem a lot clearer or a lot better at using all the correct sounds when they're pronouncing small words or even some small phrases or sentences. But when they're trying a brand new word or a really long word like hippopotamus, or even a long sentence with some tricky vocabulary in there, it might sound a lot more distorted. It might sound like all their words and the parts of the words are blending together, or might even just sound like them dropping off large chunks of the words and only saying a small part of it. And these ones can be tricky because it's not associated with a certain pattern or sound that's tricky, but more the different combinations. So you might find one day it sounds like you can understand your child, and then other days not, because maybe they're using a different combination of sounds and words. And again, motor speech difficulties typically don't occur as part of typical speech sound development. So if you do feel like you're seeing a bit of a motor speech based difficulty, it is important to investigate further with a speech pathologist. So if intervention's required, they can jump into therapy as soon as they need it. So if you do have any questions or want to investigate your child's speech sound profile further, please feel free to contact the clinic via phone or our website, and you can organise a consultative speech session with one of our speech pathologists at the clinic.